Managing breathlessness. Hello and welcome to this talk on managing breathlessness. As I'm sure you're aware, breathlessness can be one of the most disabling symptoms associated with COPD. Not only can it make carrying out normal day-to-day activities extremely difficult, but it can also trigger feelings of anxiety and as a result cause you to become less active, which further exacerbates the feelings of breathlessness and also results in you becoming breathless more easily. The purpose of this talk is to try and give you a framework for managing the day-to-day breathlessness that you experience and also go through some simple techniques that can be utilised to help rapidly relieve this unpleasant sensation. Firstly, what is breathlessness? Breathlessness can mean many different things to people. However, it is often described as an unpleasant sensation of uncomfortable, rapid or difficult breathing. It can indicate a serious problem or medical condition. However, it can also be a normal response to the current situation. For example, whenever you suddenly increase activity levels, such as when walking up a flight of stairs, your body will require more oxygen in order to perform this task. The way in which it obtains this is by causing you to breathe faster and making your heart pump harder and faster as well. This then enables the body to take in more oxygen and supply it to the muscles where it is needed. Breathlessness is very complex, and it is not as simple as saying, my COPD is mild, therefore this is how breathless I should expect to be. There are a number of other factors that contribute to how breathless we feel, and these include things such as the way in which we breathe, psychological thoughts and anxiety around breathing, and also your overall level of fitness. It is therefore important that you have some strategies to help you manage these unpleasant sensations when they arise. So, imagine you are doing some housework and you have just carried the hoover from the downstairs living room up the stairs and into one of the bedrooms. On arriving in the bedroom, you suddenly start to feel very breathless. What should you do? In this situation, the first thing I would recommend is that you stop what you are doing and look to adopt a position that you find comfortable. The Restart team, who are part of Northampton General Hospital, often use the phrase stop, flop and drop. What they mean by this is that you should stop what you are doing and try and relax your body. Sometimes when you become breathless and start to feel anxious, you tense your body up, and as a result of this, it can be difficult to take effective breaths. I would therefore recommend you try and relax your body or go floppy and ensure that your shoulders are in a relaxed position. This will then help you to be able to take breaths more easily. The drop part does not mean fall to the floor, but it means when it is safe to do so, try and sit or lie down. Essentially, adopt a comfortable position. There are a number of different positions that you could consider adopting in order to help your breathing. Essentially, all positions involve your shoulders being relaxed and your back held in a straight position. These can be undertaken while sitting or standing. One position involves leaning on a table, using your arms as support with relaxed shoulders and a straight back. Another option involves sitting on a straight back chair. And if you are unable to sit, then standing with your back against the wall can provide support and help you adopt a natural and comfortable position for breathing. Alternatively, while standing, you can lean forward, resting your arms onto something such as a table, wall, or using a shopping trolley for support. Once you have adopted a comfortable position, it is important to try and get your breathing under control. If we think back to the earlier talk, one of the reasons people with COPD become breathless is due to air being trapped within the lungs. As a result, when somebody with COPD breathes out, they may not be fully emptying their lungs. It is therefore of particular importance to focus on the out breath. By ensuring that you are breathing out efficiently, you will then have more space in your lungs when taking the next in-breath. The techniques I will go through now aim to help with the out breath. The first technique I would recommend trialling is to simply count your breathing. To use this method, you pick two different numbers, for example 4 and 7, to count while breathing in and out. You count to 4 while breathing in and 7 while breathing out. By ensuring that the numbers you use when breathing out is higher than the number for breathing in, this will always mean that you have breathed out more air than you have taken in. This method is also useful if you are feeling anxious, as if you are focusing on counting numbers, you are then unable to think about worrying thoughts that may be associated with being breathless. This can help you feel more relaxed and therefore get your breathing under control more quickly. For people who respond to things visually, utilising a technique known as rectangle breathing can be very effective. In this method, you would look for a rectangular shape that is in your current environment, for example, a door frame, window frame, or television screen. You then follow this with your eyes, breathing in on the shorter edge of the rectangle and breathing out while following the longer edge of the rectangle. You try to keep the speed at which your eyes move consistent and you're breathing in time with this. Again, by adopting this method, it is encouraging you to ensure your outward breath is longer and also acting as a distraction for any anxious thoughts. Alongside either of these two methods, you can adopt a technique known as pursed lip breathing. This is very useful as it helps to slow breathing down, but it also further helps to remove the air that is trapped within your lungs. To utilise pursed lip breathing, essentially keep your lips slightly closed as if you are trying to blow out a candle and then breathe out. The fact that your lips are partly closed firstly helps to slow your breathing down, but also increases the pressure in your lungs. This helps to keep open the collapsed airways for longer, so air can then more easily escape. Pursed lip breathing can be used with either of the two techniques previously discussed. You may also wish to use your inhaler either before adopting these breathing techniques or afterwards if you feel your breathing is not returning to normal. This would typically be your blue inhaler, which is a reliever inhaler, and helps to open up your lungs so air can move in and out more easily. Another useful item to have is a fan. There is a lot of evidence that shows holding a handheld fan around 15 centimeters from your face and allowing the air to blow directly onto you can rapidly help to relieve the symptoms and feelings of breathlessness. We generally recommend that you need a fan which has a minimum of 3 blades, as these tend to be more effective than ones with less. Hopefully, by having adopted these techniques, you will find your breathing is rapidly brought under control and you are then able to continue with your activities. If you find after having tried these for a couple of minutes, your breathing still remains difficult, then I recommend going back to the start of the sequence, making sure that you are relaxed, in a comfortable position, and trying to slow down your breathing using the techniques discussed. If you haven't used your reliever inhaler at this point, then I would recommend taking it. If you find that despite this, your breathing is still very difficult and not improving, then at this stage you should seek further medical help. I hope you found this talk useful, and we will now take any questions.